Hello everyone, welcome back to my channel. So today let's learn something about poikilocytosis, which means abnormal shape of erythrocytes and what causes them. So the most important shape is acanthocytes. Acanthocytes have irregular spicules or projections on the cell membrane. So the most common cause is alteration in cholesterol is to phospholipid ratio, and high cholesterol content in the RBC membrane can cause acanthocytes. Fragmentation of RBCs, especially when they are passing through a narrow lumen, can cause acanthocytes, and it is very commonly seen in dogs with liver diseases, for example liver cirrhosis, and it is also commonly seen in portosystemic shunts. Again, it's because of abnormal vasculature. There is more wear and tear happening during the blood flow that is causing acanthocytes, and some tumors like hemangioma, hemangiosarcoma, and DIC, disseminated intravascular coagulopathy, and some tumors like lymphosarcoma and glomerulonephritis and vasculitis can all cause acanthocytes. And coming to kodocytes, kodocytes are also called as target cells or bull's eye. So they have a distinct appearance. They have a central area of hemoglobin surrounded by a thin rim of hemoglobin at their periphery. It is really commonly seen in regenerative anemia, but what causes is the same as acanthocytes. If there is increase in cholesterol and phospholipid ratio in the cell membrane, they can become kodocytes. Dogs receiving corticosteroid therapy can also have this condition, but it is most commonly seen in iron deficiency anemias, cholestatic liver disease, and some dogs post splenectomy can also show kodocytosis in their blood smear. Coming to dacrocytes, these are like teardrop shaped erythrocytes seen in the circulation often. Again, this shape occurs when RBCs are damaged and distorted while passing through a narrow lumen. Other causes include myelofibrosis, myelophthisis, myeloproliferative disorders, and hypersplenism. Coming to exenterocytes, erythrocyte hemighost, aka exenterocytes have hemoglobin shifted to one corner and condensed, leaving the other area pale. This is most commonly occurs as a result of oxidative damage, and especially in horses when they ingest red maple, and it can also occur in glucose 6-phosphate dehydrogenase deficiency in horses, and in dogs it is a oxidative damage indicator. The most common cause of oxidative hemolysis is onion toxicity, garlic toxicity, acetaminophen toxicity, sometimes in diabetes and some infections also, and it is also reported in T-cell lymphoma cases. Coming to echinocytes, this is the shape of erythrocyte anyone will come across all the time when checking the smear, because echinocytes can happen because of faulty smearing techniques as well, but there are some diseases that can also cause echinocytes. First one is lymphoma, and hemangiosarcoma can also cause echinocytes. IMHA can cause echinocytes like spiroechinocytosis, and pyruvate kinase deficiency, rattlesnake envenomation, doxorubicin toxicity, and glomerulonephritis. All these things cause echinocytosis. And in horses, hyponatremia, hypochloremia, colitis, and echinocytosis is also caused due to exercise. And echinocytes are categorized into 3 types: type 1, type 2, and type 3. So type 1 echinocytes have very few angular edges and very few, like, the spicules are not distinct at all, and the spicules are very irregular. The projections are very irregular and very blunt. Type 2 echinocytes are elongated and they have blunt spicules all over the surface. Type 3 echinocytes are exactly round and they have uniformly distributed spicules all over the surface. Coming to elliptocytosis, they are like the elongated shaped RBCs. Elliptocytosis and ovalocytosis is very common it is normal in camelids. So the causes in cats is due to liver diseases, and then doxorubicin toxicity, and myeloproliferative diseases and tumors. In dogs, hereditary ovalocytosis is frequently observed. It is due to protein band 4.1 deficiency, and this can also be caused due to myelofibrosis, myelodysplastic syndromes, and glomerulonephritis. Keratocytes are like Burr cells, and these cells are commonly seen in microvascular injuries, liver diseases in cats, hemangiosarcoma and hemangioma, and chronic doxorubicin administration and related toxicities. Leptocytes are very commonly seen in iron deficiency anemia. We can also say that it is like a marker for iron deficiency anemia, because iron deficiency anemia is like characterized by microcytic hypochromic anemia. So leptocytes predominate in such anemias, and cholestatic liver disease can also cause leptocytosis. Schistocytosis. So they are fragmented erythrocytes. So what happens is, when the RBCs are traveling inside the vessels, physical trauma secondary to abnormal vasculature or turbulent flow can cause schistocytosis. So the most common diseases are disseminated intravascular coagulopathy, glomerulonephritis, hemangiosarcoma, myelofibrosis, dyserythropoiesis, and chronic doxorubicin toxicity can all cause. And in cats, it is commonly seen in liver diseases. And coming to spirocytes. Spirocytes are very commonly seen in immune-mediated hemolytic anemia, and this happens as a result of fragmentation, and they are actually smaller than microcytes, and they lack central pallor, and they are really small. And the most common diseases is, they are commonly seen in immune-mediated hemolytic anemia. Coral snake, rattlesnake, and bee stings can cause spirositosis, and in cattle, it is often seen in anaplasmosis. Spiroechinocytes. Basengi dog with pyruvate kinase deficiency often has this findings. Goat erythrocytes treated with lysolecithin, and spectin deficiency in Dutch golden retrievers have been reported to have spirositosis. Stomatocytosis. Stomatocytes are laughing RBCs. They have narrow elongated central pallor. So hereditary stomatocytosis is commonly seen in Alaskan Malamutes with concurrent chondrodysplastic disease. And Drench Parsound, they are also like they also have stomatocytosis with hypertrophic gastritis. It's a genetic problem they have. And hemoglobin crystals, this is one of the most interesting thing that you can often see in blood smear. So you can actually see a stick like pink color rods. They are hemoglobin crystals. So they are rhomboid in shape and reported in flavin adenine dinucleotide deficiency in dogs, llamas, and horses. But I think it is also commonly seen in few numbers in normal blood smear. So I hope this video was informative. Thank you so much for watching.